Hello, my name is Mary Claire Grounds. I'm one of the ST7 geriatric medicine registrars in South East Scotland, and today I'm going to present a project looking at patient and carer opinions and thoughts around telephone consultation during COVID. And this is a piece of work done at Liberton Hospital in Edinburgh alongside my colleagues, Dr. Sarah Marinan and Dr. Jo Renton. So today I'm going to talk about, in a little bit of detail, the Parkinson service at Liberton Hospital, and then how we changed our service in relation to the COVID requirements we were asked to adhere to. How we then took on a questionnaire in order to survey patient and carer feedback, some of the results of that, and then how we can use that information looking forward to the future service and hopefully beyond COVID. So Liberton Hospital is a community hospital in South Edinburgh, and you can see, looking down from Arthur's Seat onto the crags, you can just about see the castle in this picture, and everything that you can see in front of that is in our catchment in South Edinburgh. And we also look after patients in Mid Lothian, which is a more rural setting beyond the borders of Edinburgh. The clinic, up until COVID, ran weekly. There were 2 consultants and a specialist registrar, which is myself at the moment. And at the same time, when that clinic was running, in tandem, there would be a Parkinson's nurse specialist who would be seeing the consultant's patients, on a 6-month basis, kind of alternating. And all of this is part of the wider NHS Lothian Parkinson's service. So when the COVID pandemic hit, Lothian recommended that there shouldn't be any face-to-face clinics for vulnerable patients, and our patients with Parkinson's were included in that. And so for the last year, the clinic has been running entirely using telephone appointments. Right at the beginning, we did try some video consultation software, but unfortunately the internet connection at the Liberton Hospital really didn't support that. And so we went on with just using telephone appointments entirely. And the survey that we're going to talk about is only the consultant-led clinic. We haven't involved the Parkinson's nurses. They've been away doing lots of other things and haven't really been in Liberton so much. So this is the questionnaire that we sent out. At the end of each telephone consultation, we asked if people would be willing to complete it, and it was sent out with a copy of their clinic letter. And then on a voluntary basis, patients and their carers would fill it in and send it back to our secretaries. It was on a 2-page spread and a set of questions that patients were asked to rate their answers, going from good to bad, and then very interesting, just an open set of questions of positive and negative experiences of the clinic. In the boxes where you can see where people are asked to rate things, I'm going to draw your attention to the first 4 questions, and I'll present the data from that. And those were really looking at the service itself, having a telephone appointment. And then the questions below that are really more about the doctor themselves, and the consultants and I use that as part of our patient survey for more personal feedback. So in total, we had 38 replies, and this is some of the data that we captured. So first question, did you find the telephone consultation useful? And I think we can say that overwhelmingly, 95% of people did find that this was useful. Obviously, we're comparing this in a setting where if we didn't have the telephone consultation, they really wouldn't have any feedback. So it's difficult to judge exactly how they feel about it compared with, the standard appointments we were having before, but definitely useful. Would you prefer to be seen in person for every review? And whilst most people would prefer to be seen, I think it's notable to see that 1/3 of patients don't really necessarily feel that they need to come up to the hospital and be seen in person. And so that's something to consider when going forward. And I guess knowing a little bit about more who those people were who felt they didn't need to be seen would be further work we could do. Would you prefer some of your consultations in the future to be done by telephone rather than face-to-face? And here we're seeing more of a 50-50 split, but actually you know, again, people would be happy for some of their consultations to happen on the phone. And really, you know, that's an interesting thing. Can we build this into our service going forward? I think we had expected, as the clinicians in the service, that people were finding they didn't like consultations via telephone. And so it's really interesting that actually there were positives about this. And then, was this form of communication more useful for you than coming to the hospital? And again, we're seeing a real 50-50 split here. Some people finding it absolutely fine, more useful in some ways, some people really not finding it as good. And we'll come on to some of the themes that emerged and why that might be the case. So when the open-ended questions came back to us, people gave a lot of information and a lot of really useful comments. And when I went through all of that, there were some really clear themes that were emerging. And these are the positive themes that we saw. And one thing to say is, in this word cloud, any bigger text is that theme is more commonly represented in the text. So very clearly, people were happy not to have to travel in the context of the pandemic. They felt safer, it was more convenient, it was less stressful, and really an easier experience than coming up to clinic. And this is some of the direct quotes from the patient comments, which you can read. Feeling more relaxed, didn't have to try and find a parking space, maybe alternate appointments might be an option for that person going forward. And then one comment, you know, it was very informative, but maybe if we were making a diagnosis, we might want to see them. Looking at the negative themes, I think this is what you might have expected in the context of movement disorder, that people felt that there was a downside because over the phone, without even a video, we really couldn't examine people. We had to kind of pick up on what they were telling us and infer things from that. People were concerned that things might have been missed. And for those people who this was a new patient appointment, they'd never met the doctor before, and perhaps it was harder to make a diagnosis. And this is some of the direct quotes as well. Again, not being able to see face-to-face, not being able to see the movement that the family or carer might not have picked up the subtleties of, not being able to make that personal involvement and use body language as part of the consultation. So in summary, I think it was clear to say that people did feel that the clinic had been useful. 95 said yes. And I think we can see that actually there are advantages to coming to hospital, but there are also advantages to being at home on the phone, and disadvantages to both in different ways as well. And interestingly, half would choose to continue with telephone consultations to some extent, which I think, as I said before, was a bit of a surprise to us, as we'd been itching to get the patients back to clinic. And actually, maybe this is suiting them slightly better, at least for some. So with this information now, how can we use it to shape our service? Lothian have now said that we can see people face-to-face where felt essential, and I'm pleased to say that we had our first 2 patients face-to-face in the clinic yesterday, both new patients, and it was really helpful to see their movement and give them the diagnosis face-to-face. But how can we now prioritise those that we need to see in person? And what we're doing is drawing up a list of those who are new patients, who we've had the phone consultation but we've not yet examined, and also those where over the phone it was clear that things were changing for them with regard to motor symptoms and they'd really benefit from a physical examination. And so they're the people that we're focusing on bringing up. But the clinic will still run with the majority as telephone consultations, and it's helpful to see that does have a role. Whether in the future we incorporate what we've been doing for the last year into our longer term service plan and how we provide our service to patients is another question. In some ways, we've had the opportunity to try this method, you know, that we probably wouldn't have done before. And from what we're seeing in this survey, there is positivity towards it. The key, I think, is going to be working out who do we need to see? Who are the ones that 50% who are happy to be reviewed, perhaps alternate appointments, and who do we really need to see in person? And I think that's the next piece of work to be done. And perhaps, you know, if the surveys hadn't been anonymous, we might have been able to tease out, well, that was why they didn't like it so much, or that was why they did. Certainly yesterday I had a man who was totally fine and feeling completely stable, and everything we talked about was fine, and therefore that telephone was really suitable for him. Frustratingly, the lack of internet connection or the strength of the connection has meant that video consultations haven't been possible. It's a possible middle ground to be able to see people face to face in some ways, but without them having to do all the travel and the waiting and the parking. And in another service that I've worked in, we have used Near Me during the pandemic, which is a Scottish video consultation system and has been very positive. So I'd be really fascinated to hear what other people have you know, gathered information about and their experiences of this. I think it was surprising to us that actually positive thoughts about telephone consultation, but choosing the patients is going to be the key. Thank you again for voting for my poster and for asking me to speak. I hope that's been interesting, certainly a useful insight going forward. And if you do have any questions, then please feel free to drop me an email and I'd be very happy to discuss further. Thank you.